To the world, you are a mother, but to the family, you are a whole world. Welcome to A Journey to Motherhood. I'm Teacher Zita. Today, in case you're watching Bethany TV, this is A Journey to Motherhood. In our second episode today, we are talking about nausea. And we have a very beautiful couple here, Mr. and Mrs. Nausea, to tell us and take us through their journey to motherhood as first-time parents. Hello.
Hi.
You're welcome to the show.
Thank you.
Are you
so
okay?
much. Yes.
People look so good. Thanks so much for joining us.
Thank you.
How have you been?
Good.
Please say hello to the viewer.
Hello.
Tell us your name, what you do, where you live.
Nausea Branchard, and I stay in Woyogiriri.
Okay.
I'm born again Christian.
Thank you.
And I work from Syndicate Faith and Logistics.
Okay.
I'm privileged to be here.
Thank you so much.
Thank you for welcoming us.
Thank you. Yes, Esther.
Hello, viewers. So much privileged to be here on Bethany TV. Thank you so much, Teacher Disa.
Teacher Zita.
Zita, yes.
Yes.
That name disturbs me.
No, it's okay.
Yes, I'm called Esther Kwaga Nausea. I'm an administrator at EML, Energy Monitoring Limited, as an operations manager at the same time. I'm so happy to be here to speak about a new journey that I've just started. So much challenging and interesting.
Thank you.
Yes.
You're welcome to the show. We are talking about a journey to motherhood. Are you first-time parents?
Yeah.
Wow, that is exciting. That is very exciting. Let's go straight to our discussion, Esther.
Okay.
This is your first time to be a mother? Yes. And how is the experience?
First of all, actually, when I got to know about the news, because I was feeling sickly, at times.
That's when you discover that you're expecting.
Yes, because we had our wedding on 2nd December last year. So, like, I thought maybe it is just the fatigue.
The fatigue from the wedding.
But then I had the rest of a week. I was not working, we were home. But then it would be so hard for me to wake up. At times you would feel like I didn't start feeling like throwing up or anything like that, but I was so sickly. So I thought maybe just the honeymoon, that mood. And my husband was
the
like,
hangover.
Okay. Yes. And then he was like, you get used and all that. So when it persisted, after work, I was like, no, you have to go for a checkup. So when we went for the checkup, the doctor said, no, the first thing I have to do, I have to test for pregnancy.
Exactly.
Like all this early.
You know.
Then, like,
of course, that's what medics say.
Yes, because I've just gotten married. I didn't expect it to come so quickly. But then he came back with a smile. She came back with a smile and said, Esther and Branchard, congratulations.
You have the little one, yes.
Wow. I was so happy about it, and by then I was not so feeling so bad. So I was so much excited because I love children, I love babies. Like, oh God, it was all this quick.
You know,
because mothers at times take long to conceive. Years I've had they've taken 8 years. So it was such a nice experience. It was really a nice experience, and I was so happy.
Okay.
But then I knew that told me about a few things.
Okay.
So I was like, okay, it has come. I need to stand and maybe carry on the journey. But then I didn't think it would be all this hard. And to make matters worse, the following I had to report for work. So I reported, but I didn't want to show people. Actually, I first reported and then started work. I was not feeling normal. So when I realized, I became a bit stronger. So now I realized that it's not sickness, it's not fever. It's now the pregnancy.
This is the journey taking
yes, I was
you
like,
now.
Okay. One thing I know that every good thing comes with a challenge.
Okay, surely.
So I spoke to this baby.
That's good. That's good.
Yeah, I'm like, okay, I'll carry you faithfully.
Please
I know you'll be great, but please don't disturb me much. But because I knew I was carrying something very expensive that actually people look for, so I was like, oh, whatever you do, I'm ready.
That's very good.
Yes, I'll carry on the pregnancy and we shall move all these 9 months. So I started being so weak, I think after that week to Christmas. I thanked God that I was not working.
It was a holiday.
I could actually wake up like at 11. And then my husband would tell me, hey, like, you thought it was just 7 or 6. Actually, I could wake up and check on the clock and say, oh, it's getting to noon. But you could wake up, but then you don't feel like getting out of the bed.
Exactly, surely.
So it was not so easy for me. Thank God. I
Especially
don't know how.
those first 2 weeks.
Yes, those first 2 weeks, they were very hard for me, especially about that weakness. And then that very week that I've been talking about, I started throwing up.
Sorry.
Like every after a minute, you run. So I was like, hey, the things I used to watch, I have no experience.
It is now your turn.
Yes, so I feel like throwing up every time. I lost appetite. I could not eat. So when it got worse, I called my mother. My mother gave birth to 12 of us.
Oh, really?
So I was like, how did she manage like giving birth to all these kids, 12 of them?
Okay.
So when I called her, I told her about the same thing. She was happy because I like, okay, let's first wait. Let's not first tell the parents about everything. We're being cautious. So when I told her about the same, she was like, the way you treat that baby, the very first place, it's the same way he or she is going to take you up to the 9 months. So, and she told me, actually even the doctor told me, but my mommy's report made a lot of sense. Yes, it confirmed it. So what I did, I started waking up earlier, a bit earlier, because I have to be at work by 8. It's me who opens the office and everything. So I was like, okay. She told me if you have to go for work at 7, then wake up like at 5:30, take a shower, be there maybe in your towel, have a cup of tea, walk around. So I tried that. In the first place, it failed. Still, I could wake up when like 7:10. I have to shower. I have like at times you could wake up and then wake me up like 3 times. Still refuse to wake up. But then I had that at the back of my mind. I was remembering and said, Mommy said, whatever you teach that baby,
she'll treat you the same way.
Yes. So I was like, okay. So the times when I felt like a lot of fever, I could say, okay, let me first sit and then put the first leg down. You'd find the second down and then you stand. You feel weak, you sit again. Like that, and then he would encourage me and say, no, you can. At times even he holds me and say,
oh, that was
please
nice.
Go and take a shower. And then after that he asked me, how do you feel? Trust me, I would feel better.
You'll feel better.
So and then when I take some warm water, yes, after taking a shower, I take some warm water, walk around, try to do some little shows, but then that's how I started improving.
Thank you so much. Yes, our topic is still nausea.
Yes.
Yes. During that nausea moment, what was the most challenging part of it altogether?
The most challenging part was the general body weakness. The general body weakness. I could sit in the chairs, and maybe he calls me for something, and I even failed to stand.
So deep in his mind, he was like, now this one after the wedding, she has started changing.
No. This husband of mine, that's why, okay, I realized in my mind, and I was like, okay, so it's good to marry a friend.
True.
So I could tell him, I cannot manage. Please come. Can you please come and help? I was like, oh, sorry, I didn't know. So he comes, and maybe he sits there, and then he tells you what he wanted to tell you, or else helps you to go and shower or anything like that.
Okay.
If it is food, he tries to make breakfast.
Okay.
If you don't like it, he goes back, maybe he tries something else. And the other thing that challenged me that week on this year, like, I could not like to eat. Everything would smell bad. His Vaseline, every perfume, like every nice food, the food that I used to like.
You hated it?
Yes. I could even just sense it from afar. And
how about him? Were you comfortable with him being near you?
Yes.
Because most mothers at that stage, they don't want to be near their husbands.
Now the change was, I was feeling insecure when it was a bit far. Because at times I would feel like standing, but then he's not around. So I always wanted him to follow me, but suddenly you would see him. Hey, you're here. Okay, then also sit here.
Okay.
So you want to go back to the bedroom. So we go back together. But then I never wanted him to disturb me, like, you know. Something that I could go beyond that, I was worried. I'm like, no, don't come so close.
Okay.
Yes.
Did you used to experience these feelings before eating or after eating, morning, evening, or throughout the day? How was it?
It used to happen early in the morning and late in the evening.
So during
Actually,
the day,
I first
normal?
realized that it used to come, it first came at noon. I used to feel it and I would know, now it is noon. It would come at noon and I'd be so uncomfortable.
During
and then
that
now
time?
it has changed.
How is it
Now
now?
it's in the morning, and then now I can say it happens more in the evening. I can feel so sick, like so sick. I'm about to leave work. But then in my mind I'm like, I have to work.
Yes, surely. You have to push yourself no matter what.
Yes.
Okay.
So thank God that between, like, I always feel bad, like from, surprisingly these days I even wake up earlier. Like at 5, you don't feel it. You are awake, but you cannot get out of the bed.
True. That's
So I always tell him, me, I've been hearing everything. And then for him, when he wakes up like at 6, have you been okay?
What foods were you eating? Did you have some specific food, or you were eating everything? Because there are some mothers who can barely eat anything.
Now, like for me, not anything. I started eating fries. I wanted something like just plain.
Boiled
But I've
foods?
always liked matoke.
Okay.
Yes, I've always liked it. And at times now I've changed. Like actually for my case it changes. Like now when it was just starting, I used to hate fries. And now when it comes like to noon, I like the
you
fries.
want it.
And then late in the evening, I don't like
You
fries.
crave for something else.
Exactly. So now at times you tell him, please, can you please order for me this? And then after ordering, like, no.
I don't want it.
And you ordered already? I want something else. But he's very patient.
Okay.
Very, very patient and so much helpful.
So how are you feeling now? More energetic? Is it going? Is it still strong?
It has to go on. Like, I'm like every morning it has to work out. Especially when I wake up and I feel I'm so weak. I'm like, you woman.
Please be
We have
patient
to
with
work.
me. You know, you keep talking to it.
Yes.
Keep speaking.
I know you're great, but please, you have to be with me. I have to go for work. So that always pushes me.
Okay.
And I'm like, I don't want to get to that. I don't want to get used to the system of like being so weak. Fine, you feel so weak. Like today, I felt like, oh, you have to go. And then it's like, yes, you'll make it. But then, because we have responsibilities, are so much committed in so many things, so life has to go on. Though it is a very nice experience to me. I'm like, because I married when I'm aged, not so aged, but I was 26. I'm like, okay, some of my friends already have babies that I love so much. So I'm like, okay, this time around I have
It's
a
my
chance.
turn, yes.
So I imagine how will I be with my baby. So that pushes me to bear whatever thing that comes.
Okay.
Yes, I'm like, okay, I'll make it. And then the time I watched your show.
Okay.
I was feeling so bad. Then I was telling my hubby, the utensils in the sink, could you please help me? They're like, I'm coming. He likes doing all other things, but washing utensils is not his thing. So me, like now, the bad thing I have, if I tell him something, I want him to do it immediately.
Immediately.
Like immediately.
Those mood swings.
Yes. So when you refused, as I was watching, I got up and started washing. So the lady that had hosted said, when I had when I was in that season, my husband used to help me in everything. So I looked at him and was like, oh, I'm so sorry. Let me come and wash. So from that time, he even started like washing the utensils in case I don't feel okay.
That was nice.
Yes, you could do any other thing.
Thank you so much.
Yes.
Did you get any support treatment from the hospital to keep you strong? Because sometimes
really.
it's extreme and the doctors recommend some therapies, some medications. Did you go to that extent?
No, actually, when I went for the pregnancy test, they gave me a few tabs.
Okay.
And then they told me to go back after a month. So I'm like, okay, let me just wait for a month. So I think I was supposed to go today, and then because of the show, we couldn't make it. So I'm going to be there tomorrow.
Okay.
Yes.
Have you started antenatal care?
I haven't.
Please, you should.
I
You should, as soon as you discover that I am expecting 1 week, you should be going.
Okay.
Yes, the first month should be going, so that you prepare your body.
Yes.
The doctors can detect any kind of need where possible. Yes, don't wait for the 6-7 month. It is better now.
Yes.
The moment you train your brain and the baby to, you know, to health care, yes, they will start and, you know, getting to follow the norms very easily. It's a journey to motherhood. We have the Mr. and Mrs. Niwasima. They're telling us their journey as first-time mothers. And in case you're expecting and it's your first trimester, please don't wait for long before you go for antenatals. Start as early as possible. She's sharing with us her story and trying to encourage, trying to give us more knowledge on as far as you can handle nausea when you're a mother, especially in the first trimesters. In case you're watching us, please, you can share with us your stories. You can be able to send us messages on WhatsApp and we shall be able to read them for you out. Back to you, Noasima. When you're doing all these cravings and you feel like you can't eat, you can't feel like, do you console yourself or do you sometimes run to him? Do you call mom? Do you have anyone who supports you as a mother? Because it's very vital really when you're going through this journey for someone to be helping you out.
Basically, you can say it is my husband.
Okay.
And me, when I want something, I want it.
There and then? I
want it. So I just tell him, initially I would say, could you please get me this? But now I just even text him, I want this.
When you're seated?
Then like at times when I'm at work. When I'm at home actually, just I said, now what do you want? When I reach where I was going to get it from, he asked me, are there any changes? So I bring this. I found this, should I bring it or I change? Yes, so like I don't change in my tastes. If I want something, I want it. Now the only person I actually consult is my mother. Yes, because when you still have this, when you're still in the early stages, just weeks, you at times don't want to expose it, like so many people. Yeah, yes, sure. So I always ask my mother, how about if I see this? But one thing that I've left behind, it was that spotting. I had it, I think, like after 2 weeks. Okay. I went to the washrooms and...
Did you get cramps?
Yeah, it was some sort of cramps and all that. So the day before, someone had scared me. So I thought, oh God, let me think it's not miscarriage. So I rushed to the hospital.
But it's common, it normally happens.
I didn't know.
Oh, okay.
Yes, I didn't know that it happens. So me, I thought that any spot that you see,
something bad,
it's a miscarriage. So I rushed there, my pressure was high because I thought I was going to lose the pregnancy. Yes, so when I reached the room, it is normal, but your pressure is high. Okay. Yes, so it is always good to seek for medical attention early enough. So that when you see those signs, you actually know that, oh, it is normal. This is not normal. Yes.
True. Yes. Thank you so much, Esther, for sharing. That's your story. Let's now listen from our very own. Yes, he's going to tell us his journey. I'm so privileged to host you because not many fathers can really come up and say, let me be part of this journey. Yes, I think many fathers who are watching you outside there are so happy and proud of you. Let's get back to you. When you discovered that she was expecting, how did you react? Were you like, oh God, now someone is coming in between us? Or what was your reaction?
Actually, it was not, I did not realize it very soon.
Okay.
As she has narrated after wedding. I saw her, becoming weak every time. Okay. Then I was like, what's going on? I didn't take it serious. Okay. But later on, when we went for test, and maybe I thought she was sick actually. I thought she was sick. But when our doctor told us that, you know what, we have good news for you. I was like, oh my God. So I felt so good. Okay. I was so happy. That's good. However, along the journey, yes. It has not been easy.
I know it has not been easy, really. What are some of the challenges that you're experiencing with her?
One of the challenges that I can mention are her tests. Last time I remember she told me, I want sugar cane. I ran immediately. Actually, she told me I want red sugar cane.
Red sugar cane. What time was that?
It was around the 6.
In the morning, evening?
Evening.
Okay.
I want red sugar cane. So I ran.
How does red sugar cane look like?
There's this soft one that is cream in color, and then there's also a maroon one that's quite a bit hard.
So you wanted the hard maroon one?
Yes, and I wanted to like, to, how should I call it, to peel it myself. You know that at times you buy it when it's packed and all that.
Okay.
I wanted to do it with like a knife. I do it myself.
Okay.
Yes.
Yes, go on.
Then after when I got it, but I got it late.
Okay.
And she told me my time has gone.
The time has gone.
Yeah.
You know, those little ones work on time.
Yeah, I know.
Yes,
I was like,
yes.
okay. Now I'll buy many and bring them at home.
And did she eat really?
She can't.
She didn't eat any of that?
No, she ate like after.
After some time. Okay.
But the appetite had already gone.
Okay.
Another challenge I got, she told me I want dry fish. And it was late. It was late.
What time was that?
It was at 9 when actually I had already cooked food. She was like, I want dry fish.
So who cooks food? Is it you or her?
When she's busy,
you cook. That's good. Thank you.
I do that.
Thank you.
Because I got to know that I can't carry what she has.
Surely.
Yeah, I can't
That's the
carry.
difference.
That's the biggest difference that she has. So I have to be there for her.
True.
And I make sure that she's okay. Yeah.
So did you get the fish?
Mama.
You got the fried one.
You got the fried one.
I tried. It was not easy. I got the fried one.
And did she eat it?
Yeah, she tried. She was like, it's okay, but I need the other one tomorrow. Yeah. Another challenge.
Oh dear.
Another challenge. For me, I don't like someone who throws up.
Which she cannot avoid at that time.
Which she cannot avoid. So at times she knows that I don't like, and then she tries to avoid. Then later realize I realize no, be free.
Okay.
I'm your husband. I'll do my best to let that.
Okay, that is very good.
Yes.
Thanks so much for being caring and fatherly. That is a credit we are giving you as
so
Bethany
much.
team.
Thank you.
Yes. What new experiences have you gained so far during this time?
Of course, experience I've got, it is always to work hard so that you can take care of this woman. Because if you don't have money, aja kunyigira, then speak it in Uganda. Yes, she will feel bad. And every time she calls you, she tells you, you know what? I was not happy. What you did not make me happy.
And we hear the mother is not happy, and so is the little one, the unborn.
Definitely. Another thing I didn't tell you, when I'm at work, she always tells me, I want, for example, I want chips.
You're at work?
I'm at work.
Do you work at the same place?
Not the same place, but I work in near Gogo Nakawa. She works in Ntinda. So I have to make sure.
So how do you connect?
I have to make sure, and I get the means to take what she wants.
Quickly before she changes her mind.
Because I know that.
Did anyone ever talk to you about fatherhood before you even got married? Did anyone ever sit you down, counsel you? You know, in most cases, we think men know it all. We think a man is a man, he should be knowing all the things.
Of course, you can't know everything. I have great men that I look up to. Like Pastor Ranga Yusuf, he told me everything. You know, this woman, he told me everything regarding mothers. So, and my dad always tells me, you have to be a man. Okay. You have to be a man.
That's very good. Thank you so much. I'm sure there is a gentleman watching you there. Yes, and he's like, what? How is he doing it? Yes. What message can you give him? Especially a first-time father.
My dear friend, it is not easy, but you have to be a father.
That's very good.
You have to be a father. If it means to peel, you have to peel.
Means
like today, she told me, she after work, I was like, I'm very tired. I want to rest. I had to go and peel. Because I told her, right now, we don't need maid.
You don't need a maid, yes, you're still two.
Let us be two. I can peel. Let me peel and do whatever.
Because they always tell us it's not the mother speaking, it is the little one inside speaking.
Definitely.
Yes. Not so? Really? Yes, it's not you. Because that's not how we used to
I'm
be.
getting used. I'm getting used.
Okay. Yes. That is very good.
Yeah.
Thanks so much for being a caring father and a very loving husband, because not everybody can do it. Someone can be so busy, you have to work morning to evening, and when you come back and someone nags you, you know, you're like, what? Now this one after the wedding, she's changing. Are you the first to carry a baby? Are you the, but we are all different. And there are some mothers who completely don't experience anything like that. And others, it is severe. Others, it is mild. So whatever that God gives you, I think we can work throughout with it. It's a journey to motherhood. Thanks so much for still keeping at Bethany TV. We are sharing our different experiences with the Nuwasima family, and giving us whatever that they've been going through as first-time parents, especially during morning sicknesses and nausea. Please keep with us. We are still having a lot to discuss, and Doctor is around. Is going to give us all what we need to know about nausea and morning sickness. Yes, my dear Esther.
Yes.
What message do you have for the mothers there, those who are going through nausea, they feel like giving up, and they feel like, oh God, next time, this is the only child, I don't want any other child. Yes. Do you have some word for them?
Yeah, of course. One thing I can tell, I shouldn't call him her a young mother, but if it's your first time to carry a baby, just know it is a privilege. How much it's so much challenging, but I can say it is a privilege. Take it as a privilege, but then take it like you're not the first person.
I can't hear.
You're not the first person to go through the same. Even other people have gone through it. How much it is so much challenging, but pick up your strength and say, okay, this is my baby, because that's your blood, that's your everything. So the love that you have for your baby actually will push you to carry on.
To persist.
Yes, you can do it. Even other mothers have managed. You can also manage.
Thank you so much. Thanks so much for keeping with us. We're going to have a very brief break, and then we return with Dr. Joseph Ondeswet. Stay with us.
Bethany TV for health.
Health Minutes on Bethany TV.
Immunization is the action of making one resistant to a particular infectious disease or pathogen, typically by vaccination.
Why is immunization important? Immunization could be very much important to our children so that we can reduce on the risks of the killer diseases such as polio, diphtheria, hepatitis B.
Because a baby's immune system is not fully developed at birth, babies face a greater risk of becoming infected and getting seriously sick. Vaccination protects your baby by helping build up their natural defenses.
And it also helps to reduce on the hospital visits.
When is immunization done?
Different immunizations can be given at different age groups. At birth, ideally every child has to be immunized. As the mother is being discharged, a specialized nurse will have to tell them when they have to come back to the hospital so that they follow up their routine immunization.
Better healthcare for a better tomorrow. That was the Health Minute.
It's the back to school moment. As Bethany TV, we know the hustle you're going through to get the children back to school. Starting 15th January 2024, win a Shule pack on Bethany TV with Bethany Mwalimo. It's super easy and exciting. Look out for Bethany Mwalimo anytime on Bethany TV. Be the first caller. Tell us your name, school and class. He will then ask you a science and health related question. If you answer correctly, you'll win yourself a Shule pack full of scholastic materials, including a ream of paper, books, sanitary pads if you are a girl, pens, mathematical sets, powder milk, some grab, juice, laundry and bathing soap, toilet paper and so much more. Just keep watching Bethany TV and watch out for Bethany Mwalimo to win a Shule pack. Bethany TV, for health.
Kambanjulire Disney Junior and Daycare Center. Essomero erigenda okubangulira omwana wo naawe okkirize. Essomero lirina abasomesa abatendeke ate n'abaana babalabirira bulungi nnyo. Balina ebyokusanyisa eby'abaana ebirungi okuzaama ate n'ow'okusanyirako nga bakooye wayooyoote ate we batuuka ku byokulya. Aha! Disney Junior aweesingira ddala obukugu. Ebyentambula baabigonjoola anti balina vaani ne badriver abatendeke obulungi. Abaana mbaleetere ku Disney Junior and Daycare Center in Natete. Disney Junior and Daycare Center for a firm foundation.
Bethany TV, for health.
Welcome back from that break. It's still Bethany TV and it's a journey to motherhood with me, Teacher Zita. Right now on the set we have Dr. Joseph to take us through the entire explanation of nausea and morning sickness. It's still a journey to motherhood. Doctor, you're welcome.
Thank you.
Please say hello to the viewer.
Hello, good evening viewers. It's a pleasure meeting you.
Thank you so much. We are talking about nausea in motherhood.
Yes.
We want to look at the difference between nausea and morning sickness. How different are they? Are they the same?
Nausea is that feeling, that bad sensation like you want to throw up.
Okay.
Excess saliva, you're uncomfortable.
Okay.
Now, when it happens in the morning, and that's the time that most people have that kind of feeling, that's why they call it morning sickness. Many of the mothers in their first trimester, they experience nausea in the morning hours, especially when they are brushing.
Okay.
Yeah, so that's why they call it morning sickness.
Okay.
Now, once it goes to the extreme of excessive vomiting, it becomes now a high risk. It's a complication that needs medical intervention.
Okay. Doctor, why do women go through this process? Not all though, some are okay, but why do other women experience that nauseated feeling?
Okay. So in pregnancy, especially the first trimester,
yes,
many changes are happening in a woman's body. And most of the systems are having changes. But specifically, something is happening in the womb. There's a new organ being formed called the placenta. And that placenta comes with an abundance of chemicals called hormones. And now these hormones, they cause some changes in the woman's alimentary canal, the digestive system. And the particular hormone, maybe some people know it, it's called HCG, okay, the one you test when you're doing a pregnancy test. Now when it is in high levels, saturating in your body, there's a way it triggers what we call a vomiting center in the brain. Now the vomiting center releases some other chemicals that cause irritation in the stomach, and then some women end up throwing up.
That kind of...
Exactly.
Okay.
So it is caused by those hormonal changes. And not everyone gets it, but majority of women get it.
True.
I remember one best friend of mine is also a colleague. He had been trying to get a baby with a wife. Then one day, after 2 years of trying, he calls me. He's like, Joseph, guess what? For the first time, my wife is throwing up and we are loving it. Because
really?
It was a sign that she had conceived.
Something good is happening.
Yes, sometimes a good thing. It means that things are happening. The baby is growing. So if it is happening in mild cases and it's not causing you to be weak, to be dehydrated, to have complications, it may be a sign on the positive note that the baby is getting established in you. So some people, actually most of them, it's short-lived. Usually happens around the first trimester, and in 90% of cases, it's gone by the time somebody is 14 weeks. There are a few who may go on up to 26 weeks.
14 weeks, those are like 3 months?
3 months. And then there are very, very few people who go all the way. Those are very rare, very unfortunate to have that feeling for the 9 months. But 90% of mothers, by the time they are 14 weeks, they start enjoying their pregnancy, and then they start having appetite, they start putting on weight, they start feeling the beauty of being pregnant. So it's something that happens to most women because of that chemical called HCG, and also other hormones like progesterone, estrogen. They also have that effect on the mother's digestive system, the alimentary canal. Of course, there are also other triggers that cause people to throw up. Things like scents. If your husband is putting on wearing strong fumes, you may not like it. So sometimes men have to be sensitive and know what triggers this, and they avoid. Some aromas and scents in the kitchen. Even
soap, bathing,
the perfume in soaps, they can trigger that issue of nausea and vomiting. Then also the other triggers that we know that can cause this to happen. Some of them are psychological. For instance, if you're emotionally stressed, you may get issues with nausea and vomiting. So we need support. Then if you're carrying twins, especially identical twins, you have a higher chance of getting that condition.
Excessive
nausea, vomiting, and even getting admitted in hospital because you're weak, you're dehydrated, you don't have sugar in your body because you're not eating, you're starving, you're losing weight. If you're carrying twins, there's a higher chance that you may get this condition. If your biological mother had this issue of nausea and vomiting, there's a high chance you also may get it, you're at risk. For women who take these pills and they get nausea and vomiting, it is possible that when they conceive, they're likely to get the same because the hormones that you're swallowing are the same hormones that are released during pregnancy. So if you have had it in the first pregnancy, there's a high chance of getting it in the subsequent pregnancies. So those are some of the triggers that we know that can cause nausea and vomiting in pregnancy.
Doctor, let's talk about the sex of the children, boys or girls. Which one has a lot of nausea? Because at times you hear mothers saying, when I'm carrying a boy, it's better. When it's a girl, it's worse. Is it true?
No, scientifically, there's no correlation between the sex of the baby and the occurrence of that condition. Medically, we don't have that. We just know if you're carrying twins, if you're having some conditions which give you an abundance of that condition, those chemicals in your body, you can get issues. Then maybe some people who have other existing infections or conditions, like if someone has ulcers caused by that common bacteria which people know now called H. pylori, Helicobacter pylori, they can also be prone to nausea and vomiting. But having a boy or a girl, no, we don't have any evidence to that effect.
Thank you so much, doctor. Are there some treatment to help mothers who are going through such?
Yes, treatment number one is prevention. If you know a certain scent or perfume or certain odor or certain environment causes you to be nauseated, please avoid. Then also I recommend natural remedies. I don't think people should rush to take medication. They can, if it's mild and bearable, it's always advisable to start with natural remedies. For instance, some people have been so innovative. You find that chewing, for instance, ginger, they get some relief. Tangawizi, yes. When they put a little bit in the mouth and they be chewing all the time, the nausea goes away. Now, many people...
For how long should they chew it? They keep it throughout in the mouth or just once a day?
Whenever you feel like you're nauseated or you want to throw up, you just chew
Drop
a piece.
a little.
Yes, and chew it. In most cases, some people get relief. So that's one of the natural remedies.
Okay.
Some people have mentioned taking or swallowing coffee beans, though we know they have caffeine, so caffeine may not be so good. But if you take
For
small
the baby,
quantities,
especially.
yeah, caffeine not good for the baby. But some people just chewing or having the coffee beans in their mouth and then they spit, they get some relief. And other people try to take cold drinks. Yeah, cold drinks can help to take away that feeling of nausea. And of course, some people want to wake up and brush immediately. But if you take a simple dry snack in the morning before you brush, sometimes you feel better. And if you're taking small quantities, you know, when you sit down to have a whole plate like somebody who's not pregnant, and you take at a high speed, you overwhelm the digestive system, then there's a tendency to throw up. So if you can take smaller quantities at a time, particularly dry rations that are not scented, they are not spiced, there's a chance that you may overcome this condition of nausea and vomiting. Then if you try natural remedies and you're not being helped, the nausea is persistent, you're throwing up, you've tried avoiding scents, avoiding fumes, avoiding those triggers,
but still
and it's
not
persistent. Yeah, that's when we can come in medically and give you some medication. There are many products on the market. There are many small tablets. Some of them are difficult to swallow because it's a challenge. Already you're throwing up and you're meant to swallow a tablet. So what if you swallow the tablet that's meant to treat you? So in that case, people have come up with many innovations. There are some tablets which are palatable. You don't have to swallow them, just put in the mouth and they dissolve. And then within a few minutes, you're feeling better. Yes, they are available on the market. Then there are other patches that have been manufactured. You buy a patch, you put on your skin, and it counters the chemicals in your body that cause nausea and vomiting. So those products are on the market. Yes, so there are products on the market that can help women with that condition. You don't have to suffer with nausea and vomiting.
Thank you so much, Doctor. Okay, let's look at it that it has totally failed to work. When does nausea becomes a threat to a mother's life?
Yeah, so you've used natural remedies, they are not working, you've been given tablets and you don't find relief. So that means you need to be admitted, because if you're not admitted and you're not eating, you're throwing up, you're vomiting,
losing lots of fluid,
the nausea is too much, so you're going to be dehydrated because you're not having enough intake. You're going to have low blood sugars, you're going to be very weak, you're going to have what we call electrolyte imbalance. The minerals in your body are not balancing. You've lost sodium, you've lost potassium, so it can be dangerous for your health. You can easily collapse, you can easily faint, you can go in coma. If you get, for instance, low blood sugars, they can pick you from the roadside when you have fainted and you're not responsive. So you don't have to reach that far. If you realize that the vomiting is not being mitigated by the other factors, kindly, you need to be in hospital. In that case, what we do for us, we know you can't swallow anything, because the moment you try swallowing, you're vomiting. So what we do, we access a line, what we call cannulation. We put a cannula on your vessel and we give you intravenous medication. And many times, more often than not, those intravenous medications actually give you some relief.
Some more strength.
Now, because usually rehydrate you, we give you glucose to energize you. Then after, we give you medicine actually to stop and prevent the vomiting. The challenge that I see is that that medicine does not work forever, and you cannot always have a cannula throughout your pregnancy. So
what period does it take?
So if they give you a dose, for instance, within 12 hours it's out of your body and the nausea comes back.
The nausea keeps
so
coming
you may
back.
need a second or third dose. And then probably I recommend the time you start feeling well, because the medicine is running in your system, that's the time you can use to take the other tablets that are supposed to help you, because this time you're not going to throw them up. And then if you take tablets for some days or weeks, you may overcome this challenge, and then you get some enjoyable experience in the early pregnancy journey.
Thank you.
Yeah.
It's still a journey to motherhood. I think our lines are now open. You can WhatsApp us on 0786 050 762, or you give us a call and you talk direct to Doctor. explain to him what you're going through, and he'll give you back all the answers that you need. It's still Bethany TV. Doctor, let's look at the foods that mothers can eat or avoid during that first trimester, especially when they are nauseated.
Yeah, like I've mentioned before, for mothers who are having that nausea, who are throwing up, foods which are spiced, which are having scents, and some of them I think they try to avoid the kitchen altogether, because the moment they go in the kitchen, that scent, that aroma, it provokes, triggers nausea and vomiting. So if you have to avoid spiced foods, you have to avoid those scents, those aromas in the kitchen. If you do that, and we recommend foods that are small in quantities, foods that have lots of carbohydrates. You avoid fats. You try to eat foods that are dry rations. For instance, if you have snacks, if you have fruits that are semi-ripe, that are good, you eat such fruits. Some people think when they take pineapples, they feel better than others. So people are different. So what may be good for me may not be working for you. So you need to listen to your body and to know what works for you and what doesn't work, such that you take what is appropriate for you. There is no black that fits all. So everyone is treated as an individual. So even you need to know your body. You need to learn what works for you. You need to know those triggers. People are different. And then you study your body. The body communicates to you. So if you feel your body is telling you to do this, please, you do it. If it's working for you, go ahead. So we don't have rules of the thumb that this should be done, but as an individual, you may know. And your body can communicate. You get cravings. You feel like you want this type of food. If you try it and it's working, please, as long as it's not dangerous for your baby, you can go ahead and have it and then see how you do. But like I said, don't eat in binges. Don't have bulk food. Don't have a whole plate
at once.
Eat smaller quantities at a time so that you don't overwhelm your digestive system, because if you do that, your body will react and then you find yourself returning whatever you've tried eating. So you may be feeling like eating and you want to consume a whole plate, but please don't succumb to temptation. Have smaller quantities at a time. That can be helpful.
Thank you, Doctor. Okay. Doctor, there's nausea, severe nausea. Does it cause miscarriages?
No. There's no relationship between nausea, vomiting, and miscarriages. No. Actually, to the contrary, people who have nausea and vomiting are less likely to have a miscarriage, because the hormones that are causing the nausea and vomiting are the same hormones that are keeping the baby safe in place. So you're less likely to get a miscarriage if you have. So it's the only positive end. It's the only light at the end of the tunnel. It's the only silver lining and the dark cloud that your pregnancy is safe. If you have a normal pregnancy and you're having that condition of nausea, vomiting in pregnancy.
Last week we had a male, a gentleman who sent a message, and he was inquiring from you. Yes, and his concern was all about miscarriage. We have a caller, unfortunately, on the line. Caller, hello?
Hello?
Yes, please. Who is calling?
This is Florence.
Florence, where are you calling from?
I'm calling from Wandegea.
Yes, please.
For me personally, I'm pregnant, and I'm like 14 weeks, sorry.
Okay.
And I've not started my antenatal. I think that's too late. I'm planning to start very soon.
Okay.
But then I wanted to ask, because personally I don't like water.
Okay.
Is it good to take drink like juice, sodas, and all that? Or, but sometimes I be there and I feel like I now want some drinks like soda. I don't like water, so I don't know whether it's right to do so.
Okay.
Or I shouldn't take such drinks.
Thank you so much for your inquiry, Florence. Yes, Florence I think you've got the questions right.
Yeah, Florence, thank you for calling in. Yeah, I've heard your concern. You're at 14 weeks and you have not yet done antenatal. I advise to do antenatal as soon as you can. We don't encourage people to take sodas carbonated drinks at large, because you're likely to get lots of bloatedness and gas and irritation of the digestive system. So if you can try taking water, that would be the best. But if you can't, you can try porridge, you can try juice, you can try yogurt, you can try milk products in the meantime, as your body tries to learn how to take water. Water is very important in pregnancy. Yes.
Thank you so much. I was still explaining to you about the other gentleman. I've forgotten his name though. He said so far they've had 2 miscarriages, that the wife can become so sick, admitted, she blacks out, and in the end they lose the baby. Yes, that is actually what he was asking, but we did get time, and I promised to bring that question to you today. What could really be causing it?
So that's a different issue. The wife is able to conceive, but for some reason she can't keep the pregnancy.
Yes, she loses it.
She keeps getting miscarriage. We call them recurrent pregnancy losses.
Okay.
Now, unfortunately, most times we never get to know the causes of miscarriages, but for those that we know, there are things that we know that can cause miscarriages. For instance, if you have underlying infections in your system, there are particular infections, we call them torches. There are viruses, there are infections, STIs like syphilis, infection like malaria. Some of them we know, if you have such, the chance, brucella, you've heard of brucella?
Yes.
Brucella abortus, it is highly associated with miscarriages. So if your wife has been getting miscarriage, very unfortunate, but you need to be in hospital. They get a thorough checkup. We do some lab tests to rule out some of those infections that I've mentioned. If we get any of them, we treat before the next conception. Actually, I advise she should not conceive before the cause is ascertained. Then after that, you can try conception when she has received proper treatment. There's a chance that she can carry the baby. I'm assuming that the pregnancies are coming out in the first trimester.
Okay.
If they're coming out in the second trimester, it could be another cause probably, which is structure, which is anatomical, where the cervix is weak, uterus has abnormalities. There you need to be assessed, and if possible, the mother gets a stitch at the end of the first trimester so that the pregnancy can be maintained to 9 months.
Okay.
So a thorough assessment of his wife is necessary.
It's very necessary
to prevent a future miscarriage.
True. Thank you. Because they might be thinking, when you're expecting, your immunity is very, very low. Now, if you have other infections and you're not aware of it, really, you're likely to have challenges. I'm sure he's watching. Peter, I'm sure you're watching. You've had all the answers from doctor. Take time and visit at least a specialist and rule out what could be happening. We are running short of time. Doctor, is there anything that a mother can, especially those who have severe morning sicknesses, is there any remedy that they can take to boost their immunity before they conceive so that they don't experience a lot of morning sickness?
Unfortunately, you can't prevent, there's nothing you can do to prevent nausea and vomiting. Okay. If you have those factors we mentioned in you, if your mother had excessive vomiting, if you're carrying twins, if you're exposed to those fumes and scents, the only thing you do is just don't fear to conceive. Conceive. Okay. If it happens, just face it and come, and we give you some solutions. We've talked of natural remedies. We've talked about avoiding such environments and triggers, and then coming to hospital for medical assessment and treatment. But you cannot prevent before conception. Otherwise, you may be fearing to get even twins. There's somebody I told them that if you conceive twins, you have a higher chance of getting nausea and vomiting. Like, I'll not get twins. But there are many who have gotten twins and they are not vomiting, they are not having nausea. So there is no way you can prevent it. But if you had it in the first pregnancy, you are likely to have it in the second pregnancy. So you have to just be cautious. You follow our recommendations. You avoid those triggers, and then natural remedies like we mentioned, ginger, coffee beans, and then taking small dry rations. These dry rations like snacks, they may be very helpful, and avoiding binge eating. You don't overwhelm your digestive system with large plates of food. So you have to know that. And there is medication for those who have excessive vomiting.
Thank you. We have a message from Immaculate texting in from Luzira. She's saying she's currently 31 weeks and 4 days, but I have a lot of pain in my right upper abdominal side or rib. And under the breast, it hurts so much, and it comes with a burning sensation. And when I touch around that area, I feel so inflamed. And I have tried Musogel syrup, something like that, but it, yes, I think the way she wrote it, yes, she wrote MU, but it hasn't helped. Any advice, doctor? And then the last one is saying, hello doctor, I'm Jacinta from Salama. This is my second baby. I'm 7 weeks pregnant, but I don't want to eat food. I only take G-nuts and matoke. Others I'm not trying. And why is my urine so smelly? Yes, we could start with Immaculate.
Immaculate from Rosita, thank you for writing to us. You're having pain in the right upper quadrant of your abdomen. It's not for, you're treating ulcers, but it may not be ulcers. Ulcers usually happens in the center.
Okay.
What is happening to the right is something to do with the liver, with your gallbladder. You need to have your pressure checked because we know preeclampsia can cause issues on the liver on the right side, and you get pain that side. However much you take mucogel, antacid syrups, they will not be of help. So my advice to you is you go for checkup. They check your blood pressure. If it's normal, they can do a scan to look at your gallbladder, your liver. If they find any lesion, any mass, any tumor, you can receive the right treatment after diagnosing the cause of the pain in the right upper quadrant. That's the area for the liver and for the gallbladder and the kidney on the same side, the right kidney. For our friend Jacinta from Salama, you're 7 weeks and you have no appetite, and you just eat G-nuts and matoke. 7 weeks, it's okay. You can enjoy your matoke and G-nuts. You can try taking some other drinks, juices, yogurt, and porridge. Then in a few weeks' time, probably your appetite will be back, and you'll start enjoying the full meals. In case you feel like you're missing out on your favorite dishes, there's medication that can be given to enhance your appetite, and then you can start enjoying your other favorite dishes. Otherwise, thank you for writing to us, Jacinta from Salama.
Thank you, doctor. The last one, we're running out of time. She's Sarah from Chireka. She had a miscarriage in 2022, but up to now, she hasn't conceived yet, and she's not on family planning. What could it be?
Yeah, Sarah from Chireka, what you're having is called secondary infertility. It's good that it was bad that you miscarried, but it's good that you were able to conceive at that time. I don't know at what age the pregnancy came out. We don't know what caused your miscarriage, but now the challenge is conception. There could be another factor that came up in between after the miscarriage that prevents you from conceiving. You need to come with your husband. We do some checkup. Maybe we can find the underlying cause of your infertility. It could be the tubes, it could be the cervix, it could be the husband with sperms, because sperms change with time. Your husband can make you pregnant this month, and after 6 months, the sperms are weak. Yeah, so we need to assess him as well. If we get to know the cause, then we can give you the right medication, and then probably you conceive, and maybe this time around you don't miscarry, you conceive up to 9 months.
Thank you so much, doctor. We are out of time, and I want us to look at a few tips about nausea, which are very important to mothers. Number one, avoid eating fatty, greasy or oily foods, just like doctor said. 2, it is temporary. The more the baby grows, the less severe it becomes. And then get plenty of fresh air, especially in the morning. Take a walk, encourage yourself, boost yourself. Don't be redundant, don't be in one place. Motivate yourself, drive yourself around if you can. Take a walk, wash, do something. Like, keep yourself busy, engage yourself in many things so that at least you can distract the baby or the situation and you get better. And then lastly, you should know that it is a part of your journey to motherhood. Doctor, we are signing out, please.
Thank you very much.
Yes, your last word to someone watching there and they're really struggling with severe nausea. Yes.
I want to thank the viewers for their time, and also to encourage mothers to always do antenatal as soon as possible. And for those who get challenges with nausea and vomiting, please don't hesitate to approach us. We can give you advice, give you medication, and make sure that you enjoy your journey into motherhood. It's our pleasure to see you healthy, eating well, and enjoying your pregnancy. So whenever you have any challenge, please feel free to come to us. do antenatal and consult, and then we shall give you the best advice after doing a thorough assessment on the cause of nausea. Also, as something that we forgot, some people have nausea because of other infections like and conditions like malaria and pregnancy. So sometimes you may treat the nausea, then you forget that there's malaria which can be overriding the effect. So it's always good to also think about other possible causes of nausea in pregnancy, not to focus on the hormones, but to have a broad mind so that you don't miss out on some other causes. Thank you very much for watching. Be blessed.
Thank you. Don't miss next Saturday. We are going to be having infection as our topic during A Journey to Motherhood. And tomorrow we're having Medical Mind, and we're going to look at infertility in men with Dr. Underbart at 8 at the same place here at Bethany TV. Together with the team, thanks so much for being a part of us. In case we've not read your message, time is out. We shall start from there next week. Please have a very good night. See you then.